Today I am, you must have heard about emergency contraceptive pill, also known as I pill, unwanted 72, morning after pill. Common questions which come into our mind is, how effective is it? Does it affect future pregnancies? How does it work? How to take? When to take? Does it cause weight gain? What are the side effects of this emergency contraceptive pills? Hi, I'm Dr. Neeru Mehra, Senior Consultant Obstetrician and Gynaecologist at Cloud9 Hospital, Sector 14, Gurgaon. Today I'm going to talk about this emergency contraceptive pill, and I hope to answer all the questions which we have just enumerated. So what is an emergency contraceptive pill? As the name suggests, it is something which is to be taken in an emergency, which means if there has been anything which you feel might lead to an unwanted pregnancy. So to tackle that, we have the emergency contraceptive pill. This emergency can be either in the form of an unprotected intercourse. It can be because if the condom you were using got ruptured or tore, or it can be that you have been on a regular contraceptive pills but you have missed two or more than two tablets and you've had an unprotected intercourse. So these are the various emergencies in which we can use this unwanted or unwanted 72 or the morning after pill. But as the name suggests, there is nothing morning about it. So this basically consists of a single tablet, which is basically a progesterone, levonorgestrel. So this needs to be taken. There's only one tablet, and this needs to be taken as soon as possible after you had that untoward incident. Can be taken means that it is effective even if you take within 72 hours. After 72 hours, it's not going to be effective at all. But actually should be taken as early as possible, because the effect would be, if it is taken as early as possible, it will be more effective. So let's see how to use it, and how does it work. So basically this hormone which is there in this tablet, it delays the ovulation or might even inhibit the ovulation, so thereby preventing a pregnancy from occurring. Suppose the ovulation has occurred already. So in that scenario, what it does is that there is a cervical mucus plug at the entrance of the uterus. So this hormone causes the thickening of the cervical mucus. So the sperms, they are not able to pass through it, and so that the pregnancy is prevented. Now then you might ask, even now, that if suppose the sperms have already reached inside and after that we took the pill, then what happens? So in that scenario, it acts on the lining of the uterus, which we call as the endometrium, and it makes it unfavorable, so that the pregnancy which is formed, the embryo, is not able to latch on there, is not able to stick there, and so it prevents the pregnancy. But if you have taken this way beyond 72 hours, then it might not be effective and you might end up with an unwanted pregnancy. Side effects of this tablet are very few. Usual, like you might have a little bit of nausea, vomiting, and there might be a little bit of headache, some amount of spotting might be there, and then there might be some amount of irregularity in your cycles. That can also happen with this eye pill. The thing is that if you've taken this tablet and you had vomiting within about 1 to 2 hours of taking the tablet, so that means it did not get any time to get absorbed. So it is always better to take one more tablet, or to avoid having this, have something to eat. Don't take this tablet on an empty stomach. have something to eat, and after that take this tablet so that you don't have a vomiting sensation. Then we get a lot of patients who to be on the safe side they say कि मैम अगर हम 2 ले लें तो डबल इफेक्ट हो जाएगा, डबल प्रोटेक्शन हो जाएगी. इट डजंट वर्क दैट वे. अगर आप इफेक्ट आना है तो एक टैबलेट का जगह 2 टैबलेट से आपको कोई एडिशनल बेनिफिट नहीं मिलेगा, बल्कि और थोड़ा सा आपके साइड इफेक्ट्स जो हैं वो और थोड़े से ज़्यादा हो जाएंगे. और इसके बाद में कई बार ये होता है कि नाउ द थिंग इज बट यू हैव टू रियलाइज दैट इट इज़ एन emergency contraception. It is not a regular means of contraception. ज़्यादा से ज़्यादा एक साइकिल में एक बार ले ली, अगर ज़रूरत पड़ी या 2 बार ले ली, नॉट मोर देन दैट. अगर आपको एक साइकिल में 2 बार से ज़्यादा लेने की ज़रूरत पड़ जाती है, सो दैट मीन्स दैट दिस यू नीड अ better method of contraception, which would be a normal contraceptive pill. इसमें कई बार ऐसा भी होता है कि पेशेंट से पूछते हैं कि मैम अब हमने ये पिल खाई है, अब हमको कब पीरियड्स आएंगे, हमें कैसे पता लगेगा कि हम प्रेग्नेंट हो गए या नहीं हो गए. तो उसमें यही होता है कि अगर देखिए अगर आपने ये टैबलेट फर्स्ट हाफ ऑफ द साइकिल में खा लिया, अगर आपने पहले 15 दिन के बीच में आपने उस टैबलेट को खाया, तब उसमें ये है कि 5 दिन, 6 दिन, 7 दिन बाद, मैक्सिमम 10 दिन बाद में यू विल गेट सम अमाउंट ऑफ ब्लीडिंग, सम स्पॉटिंग, और मे बी इवन माइट इवन गेट अ रेगुलर पीरियड. अगर आपने लास्ट के सेकेंड हाफ में इसको खाया है, सेकेंड हाफ ऑफ योर साइकिल, तो उसमें कई बार ऐसा होता है कि पीरियड आपको स्पॉटिंग भी नहीं आ सकती, ब्लीडिंग भी नहीं हो सकती, मे बी योर पीरियड माइट ऑल्सो गेट अ लिटिल डिलेड ऑल्सो. ओके, and it might be a little heavier. बट एक प्रिकॉशन रखनी है आपको कि अगर किसी भी टाइम पे आपने ये पिल ली और अगर आपको हफ्ते से ज़्यादा, हफ्ता या 10 दिन के ऊपर आपका डेट नहीं आई है, जो आपकी पीरियड्स आने चाहिए थे उससे 10 दिन लेट हो गया, या आपको बहुत ज़्यादा पेट में दर्द होने लग गया, या एनी अदर प्रॉब्लम, देन इट इज़ ऑलवेज बेटर टू गो एंड सी योर डॉक्टर, सो दैट ये ना हो कि कहीं पे कुछ और प्रॉब्लम अंदर डेवलप हो जाए. So this was all about the emergency contraceptive pill, and see you next time. Bye.